Well, thank you. And as Lieutenant Governor, we have spent a lot of time and energy dealing with health care here in the Commonwealth of Virginia. It's very important that all Virginians have access to affordable and quality care. There are three pillars that support health care. The first is quality. And we have very good quality, not only in Virginia, but in this country. We have people coming from all over the world to receive our care. The second is access. And we still have a lot of work to do in that area. As you know, we have 400,000 working Virginians right now that don't have access to coverage. And no individual or family should be one medical illness away from financial demise. So that's just unacceptable in the richest country in the world. Healthcare should be a right. The third pillar, and it's the one that will take this Commonwealth and this country to its knees, is the cost issue. And I don't hear enough people in Washington talking about the cost of health care, but it's on a trajectory that we can't continue. So it's very important that we have people at the table in Virginia that understand health care so that we can get the cost issue under control. Well, it's a great question, and cost is a tremendous challenge here in the Commonwealth of Virginia regarding health care. The first thing that we need to do in Virginia, and this happens through leadership and having people that understand health care, is not be giving money away to other states. And that's exactly what we're doing by not expanding Medicaid. Every day that we don't expand Medicaid, we're not only leaving on the table, but we're giving to surrounding states over $6 million a day. Since January of 2014, we've given over $10 billion with a B dollars. We'll never get it back. That's inexcusable. So leaders in Virginia need to put the excuses aside and do everything that we can to keep our resources here in Virginia. There are three things that I will mention very quickly that we can do to address cost. The first is we need to evolve from what I would call a quantity-based system to an outcome-based system. I, as a physician, am incentivized by how many patients I see a day, how many tests I order, how many patients get admitted to the hospital, etc. So we need to shift from that to more of an outcome-based system. In other words, how healthy is the population that we take care of? The second way to control cost is by prevention. And we spend so much of our resources in diseases and disorders such as type 2 diabetes, cigarette and smoking-induced cancer, cardiovascular disease. These are conditions that could be prevented. So we need to shift our resources from those that we're treating to more of a prevention mindset. As they say, an ounce of prevention is worth a pound of cure. The third way we address cost is through what I think is so exciting here in the Commonwealth of Virginia, and that's what we call personalized or precision health care. In other words, through data collection, data analysis, through knowing now that we've mapped out the human genome, we understand proteins and receptors. When a patient comes in, we can know exactly what their diagnosis is and exactly how best to treat them. And what that will do is it will improve the quality of the care, it will decrease cost, and it also is an economic driver in the Commonwealth of Virginia. So a lot of work is going on, especially with Inova healthcare system in Northern Virginia with personalized health care. You know, when people ask me, Ralph, what is the most pressing challenge that we have in Virginia right now? My answer would have to be the opioid crisis. Just this past year, we lost over 1,200 Virginians to opioid overdose. That's more than will die in motor vehicle accidents, and that's something that we should all find is unacceptable. And I remind people it's a problem that does not discriminate. So what are we doing in Virginia? We have been very diligent in working on this challenge, starting with our leadership from Governor McAuliffe. Our Attorney General Mark Herring has been involved, as have I. The first thing that we need to do as providers is talk about new ways, different ways to deal and treat both acute and chronic pain. And so I have been working with our medical schools, reaching out to providers, also to students and residents, nurse practitioners, PAs, all of these folks can prescribe medicine, and talking to them about the importance of not over-prescribing narcotics. And that's going well, and people are paying attention to that. The second area that we really need to address is law enforcement. And you know, there are far too many individuals that are addicted to opioids who are in our jails and penitentiaries, and that's not the best place to be able to help them. The third area is funding mental health care. And we've put just $30 million in our budget this year to deal with mental health care. A lot of that will be used for opioid addiction and opioid treatment. And we want to make sure that individuals that have challenges with this have same-day access to see a provider, and so this funding that we put in this past year will help with that. Finally, we have written a blanket prescription in Virginia for naloxone, which is also called Narcan. It's a medication that is able to reverse the deadly side effects of opioids. Now someone can go into a pharmacy and with no questions ask for a dose of Narcan. So if there are individuals that you know, whether it be someone in your family or yourself or your friends or neighbors, let them know that they're able to go into a local pharmacy and get a dose of the Narcan, and that's life-saving. So a lot is going on in treating the opioid addiction issue, but we still have a lot of work to do. It's going to take all of us working together to really conquer this challenge. Thank you for that.